Today, our experts will share the details of how this principle is being implemented across the recovery agenda. Allow me to briefly highlight a few areas in which I am personally involved. Mental health recovery. When a building is destroyed, what remains is not only rubble and graves. There are also hundreds of people living grief. Relatives, friends, and many, many more living in anxiety and fear, knowing they could be next. According to the latest sociological studies, more than 80% of Ukrainians are living in a chronic state of stress and emotional strain. We have many internet memes about this, sad ones, of course. The kind where after yet another shelling, people write in work chats, "Survived, so I'm going to go to work today." Our economy continues to function thanks to millions of people who go to work after spending their nights in basements. But in those moments, the main emotions they carry are fatigue, tension, and despair. Already in the first months of the Russian invasion, Ukraine responded to this challenge with the all-Ukrainian mental health program, How Are You?, which I patronize. It is a full support system in which all ministers, regions, and communities are involved and work in coordination. It is a network of services where various mental health service providers know about one another, because only in this way can a person avoid getting lost in their search for help. The key principle, mental health in all sectors and all policies, is now enshrined in law, signaling that change is irreversible. Right now, it is critically important for Ukraine not to lose momentum and to continue backing changes in state policies in this area. Much effort is also being directed towards scaling up to ensure that mental health services reach every community, and this requires support from partners. The key actor in this field is the Coordination Center of Mental Health under the Cabinet of the Ministers of Ukraine. Its representatives are part of the Ukrainian delegation here, and they are ready to respond to any of your requests and questions. When people arrive at hospitals after another Russian strike, they suffer severe injuries, blast wounds, burns, crushed limbs. Saving their lives alone is not enough. We must help them live fully again. Therefore, today, we have 11,000 rehabilitation specialists working across the country, 7 times more than in 2022. In just the last year and a half, they have helped 600,000 Ukrainians. This is also the result of state policy. Our specialists have the opportunity to learn from colleagues in the world's best clinics, for which we are deeply grateful to those clinics and to your countries. But our own expertise has also grown to the point where we can share it. For this purpose, Ukraine has launched a medical partnership that direct international cooperation between medical institutions. I invite you to join and thank those who have already become part of it.